Welcome to the Activation and Integration Techniques presentation. The purpose of this presentation is to provide the health and fitness professional with the knowledge and rationale for the use of isolated and integrated strengthening exercises within a corrective exercise program. Following this presentation, the health and fitness professional will be able to understand the rationale for both activation and integration techniques, understand the precautions and contraindications for both activation and integration techniques, and design a corrective exercise strategy using both activation and integration techniques in conjunction with the previous two phases of the corrective exercise continuum. Phases 1 and 2 of the corrective exercise continuum address the overactive myofascial tissue that can restrict optimum joint range of motion and ultimately decrease movement ability. The third phase of the corrective exercise continuum is activation. Activation refers to the stimulation or re-education of underactive myofascial tissue. Because human movement system impairments include both overactive and underactive muscles, a comprehensive corrective exercise strategy must also address the underactive muscles. The final phase of the corrective exercise continuum culminates with integration techniques. Integration techniques are used to re-educate the entire human movement system back into a functional, synergistic movement pattern. The use of multiple joint actions and multiple muscle synergies helps to re-establish neuromuscular control, promoting coordinated movement among the involved muscles. This presentation will review the science and application of these last two phases of the corrective exercise continuum. Activation techniques. We will start with the activation techniques. The purpose of muscle activation techniques is to improve intramuscular coordination of a specific muscle or muscles. This is accomplished through a combination of enhanced motor unit activation, synchronization, and/or firing rate within that muscle. Improvements in these neuromuscular components will lead to enhancements in a muscle's capability to produce force. This can be accomplished through the use of isolated strengthening exercises. Isolated strengthening exercises allow for increased force production capabilities through both concentric and eccentric muscle actions throughout the full range of motion of a joint or joints associated with the particular muscle. This is important to achieve prior to performing integrated multi-joint exercises in order to avoid overcompensation of synergistic muscles known as synergistic dominance. Isolated strengthening exercises are recommended to be performed immediately following inhibitory and lengthening techniques, but prior to integration exercises. The rationale for this sequence is due to the fact that inhibitory techniques decrease the overactivity of tissues that might prevent the client from properly activating the targeted muscle. Also, lengthening techniques increase the extensibility of the tissues that are restricting proper and complete range of motion of a joint, which will also affect the ability to activate the targeted underactive muscle. Once the overactive musculature is inhibited and joint and tissue range of motion is enhanced via lengthening techniques, the targeted underactive muscle is able to activate through a full range of motion as a result of improved intramuscular coordination. The muscle will now be better suited to control the joint it affects and work synergistically with other muscles during dynamic movements. Isolated strengthening exercises should be used with caution when training special populations, individuals with neuromuscular disorders, or individuals with poor core stabilization. Poor core stability can lead to compensations while performing the exercises and thus defeating the purpose of the exercise. Isolated strengthening exercises are contraindicated for use on muscles that have been acutely injured, strained, or torn, or if acute rheumatoid arthritis is present at the joint or joints being affected by the exercise. Isolated strengthening is also contraindicated for clients exhibiting impaired joint motion and pain produced during the movement. Depending on the intensity and volume of the exercises used, isolated strengthening exercises can be performed 3 to 5 days per week, completing up to 2 sets of 10 to 15 repetitions per exercise. Focus should be placed more on the isometric and eccentric components of the repetition rather than the concentric portion of the repetition. The tempo is a 2-second isometric hold at the end range of motion, or when the muscle is in a shortened position, followed by a 4-second eccentric contraction back to the start position. Integration techniques. Once the appropriate muscles have been activated, the last component of the corrective exercise continuum, integration techniques, through the use of integrated dynamic movement, can be performed. Integrated dynamic movement involves the use of dynamic total body exercises. Collectively, integrated dynamic movement enhances the functional capacity of the human movement system by increasing multiplanar neuromuscular control. This is achieved by utilizing exercises that focus on the synergistic function of the stabilization and mobilization muscles of the body. The remainder of this presentation will review the scientific rationale for integrated dynamic movement and provide application guidelines for integrated dynamic movement exercises. It is suggested that many injuries occur during eccentric deceleration in the frontal and transverse planes as a result of the inability to control postural alignment. Furthermore, it is known that multi-joint motions promote and require greater intermuscular coordination to achieve the desired outcome and is often the reason for their use. Research has shown that the short-term use of unilateral and bilateral exercises is both effective at increasing performance measures and that unilateral exercise has a greater influence on unilateral performance. Also, the use of overhead movements, often used in integrated dynamic movements, help to place increased stress on the core musculature. This alludes to the importance of using multi-joint exercises in all planes of motion from both bilateral and unilateral stances to help increase intermuscular coordination and re-educate the neuromuscular system to maintain proper postural alignment during functional activity. Thus, the premise in using integrated dynamic movements is to promote high levels of intermuscular coordination in a progressive manner to simulate functional activities. By doing this, we help to re-establish postural control and decrease the risk of injury. Integrated dynamic movement involves low load and controlled movement in ideal posture. This helps to ensure that joints start and remain in proper alignment, muscles function in their proper length-tension relationships, and synergistic muscle recruitment is optimum. Integrated Dynamic Movement Program Strategies. The importance of integrated dynamic movement lies not just in the movement patterns themselves, but in the progression of the movement patterns as well. For example, a base exercise consists of a two-legged exercise with minimal challenge to one's stability, such as a ball wall squat with an overhead press. Progression from here is to alternating or staggered stance exercises, such as progressing from a step-up and then to a lunge. Finally, one should progress to a single-leg base of support exercise, such as a single-leg squat, to more dynamic movements on one leg, such as multiplanar hops with stabilization. This progression can be performed first in the sagittal plane before progressing to the frontal and transverse planes. The incorporation of upper body movement, plane of motion, and challenge to stability can also be added. Integrated dynamic strengthening exercises should be used with caution, particularly when training special populations and individuals with neuromuscular disorders. It is also contraindicated for use on muscles that have been acutely injured, strained, or torn, or if acute rheumatoid arthritis is present at the joint or joints being affected by the exercise. It is also extremely important for the health and fitness professional to be aware of the position of the exercises they select for the client, such as supine, prone, or decline positions, and if the position is appropriate relative to any medical conditions that the client may have, such as pregnancy, hypertension, or coronary heart disease. Integrated dynamic strengthening movements are also contraindicated for any joint suffering from an acute injury. Depending on the intensity and volume of exercises used, integrated dynamic strengthening exercises are safe to use anywhere from 3 to 5 days per week. Depending on the needs of the client, one can perform 1 to 3 sets of 10 to 15 repetitions with a slow and controlled tempo. Generally, only one integrated dynamic movement is necessary to use, though others can be incorporated if desired. The individual's physical capabilities should also be taken into consideration when selecting an integrated dynamic movement. Summary. In summary, the activation and integration phases complete the corrective exercise continuum. Phases 1 and 2 of the corrective exercise continuum address the overactive myofascial tissue that can restrict optimum joint range of motion and ultimately decrease movement ability. The third phase of the corrective exercise continuum is activation. Activation refers to the stimulation or re-education of underactive myofascial tissue. Because human movement system impairments include both overactive and underactive muscles, a comprehensive corrective strategy must also address the underactive muscles. The final phase of the corrective exercise continuum culminates with integration techniques. Integration techniques are used to re-educate the entire human movement system back into a functional, synergistic movement pattern. The use of multiple joint actions and multiple muscle synergies helps to re-establish neuromuscular control, promoting coordinated movement among the involved muscles. The application of these principles to localized muscle components, followed by integration into synergistic and functional movement patterns, completes a comprehensive program for both training and rehabilitation. Please refer to the exercise video library for examples of isolated strengthening and integrated dynamic movement exercises.